Thank you very much for all the audience. Thank you very much for rejoining us. As I promised in the previous section, this is a time to now look at how the community pharmacists helped us in delivery of safe healthcare in the front line when COVID was really raging, and how they helped us cope with some of the pressure that came through, and also the immense sacrifice they made. So we'll start off with BC Bright, who will talk about the overall issue, and then Dr. Catherine Duggan, who will speak from behalf of the International Pharmaceutical Federation and bring out that opinion. And lastly, Dr. Ananta Naik Nagapa, who will be finishing off with the community pharmacists and their role in India. And now I'll ask the team to start the broadcast. Thank you.
Good afternoon, ladies and gentlemen. You're welcome to the community pharmacist section. And today's theme is centered on medication and overall patient safety. My name is BC Bright, and I'm the Chief Executive Officer of Live Well Initiative LWI in Nigeria, a non-profit patient organization based in Nigeria, West Africa. Our speakers for this session are Dr. Catherine Duggan, the CEO of the International Pharmaceutical Federation, FIP, and Dr. Ananta Naik Nagapa, the President of the Association of Community Pharmacists of India. I'll give a very brief outline of the session. Now, since the pandemic, we know that community pharmacists have played several roles in several capacities in the different countries around the world. And community pharmacists actually are often considered as a fourth emergency service next only to the police, the ambulance and firefighters everywhere in the world. And so they're a very, very important and integral group in the community, and they serve a very key function, not just health-wise, but socially. So during the COVID-19, they were placed at considerable risk while serving patients who were shielded. And patient safety is now a concern for all frontline healthcare professionals, as well as their employers. So all community pharmacists, pharmacy technicians, and pharmacy support staff have recognized the importance of safely dispensing medication and providing adequate advice to patients and the public. So this session will celebrate the achievements of community pharmacists by sharing their experience. I'll quickly introduce to us the first speaker, who is Dr. Catherine Duggan. She has played a key role in the FIP, and especially during the pandemic. And because she is CEO, she will start by introducing to us what the FIP is, and she's going to outline to us very quickly the roles that FIP has played and pharmacists generally around the world. Once she's done with her paper, then we will have Dr. Ananta Naik Nagapa, like I said earlier, President of the Association of Community Pharmacists of India. Now over to Dr. Duggan. Thank you very much.
Hello, everybody. My name is Catherine Duggan. I'm the Chief Executive Officer at the International Pharmaceutical Federation, FIP. Today, I'd like to walk you through some of the pharmacy's response during this global pandemic. Before we start, a little bit about the organisation. The International Pharmaceutical Federation is a non-governmental organisation. It was set up in 1912, based in The Hague in the Netherlands. And we've been in official relations with the World Health Organization since 1948. We consider partnership to be key with how we work in our communities, in our regions, and globally. And we are looking forward to working more closely with global patients. So the presentation that I have for you today is a little bit about FIP's response to COVID-19, how we have responded to support pharmacists, pharmaceutical scientists, and pharmacy educators globally through our guidance, through our digital program, through our repository of resources, and other initiatives. I wanted to outline for you FIP's call to action and advocacy initiatives, and to provide you with some outstanding examples of good community and hospital practice, as well as a little bit of insight into how our educators have responded globally as well. So, how did we respond to the global pandemic? Following the WHO's declaration of the outbreak of COVID-19 as a public health emergency of international concern at the end of January, we set up a task force to develop emergency guidelines to support the pharmacy workforce around the world. And the aim of this was that we would try and minimise and control the outbreak, and also to provide some advice to the pharmacists who are on the front line. Since that time, we have updated that guidance 3 times, including June 2020 of this year. And in the meantime, we've issued holding statements and updates to different pieces of the guidelines as evidence has emerged around, for example, hydroxychloroquine and the testing. The task force, we ensured, included representatives from all practice settings, including hospital pharmacy. At the present time, the guidance is available in 5 languages and includes the following documents. We divided them into the following sections: clinical information and treatment guidelines. This has been particularly interesting because it's almost like during a week, the evidence can change around clinical use of medicines. Guidelines for pharmacists and the pharmacy workforce themselves, how to manage themselves, how to manage the patients they are serving. Frequently asked questions and myth busting. This has been particularly useful because we have a lot of professionally led questions, weekly, daily, but also pharmacists want to be in a position to be able to bust the myths that patients are faced with as well. And given that pharmacy is one of the only key and essential services that have been found on everybody's community, we have found that having some myth-busting guidance has been hugely important for the pharmacists that we work with. We've produced some additional resources for COVID-19 and some summary guidance sheets, and these have proved really useful. We found that that has been one of the biggest help for our pharmacists, and indeed patients who want to know more or perhaps have family members that they need to support better have found those guidance sheets to be really important. In order that people found things easily, we developed a dedicated web page and a resource centre, not surprisingly called www.fip.coronavirus, which I think if you went to all organisations' web pages, they would all have a coronavirus section on it. So no points for originality. I wanted to show you a little bit of the web page so you can see. It's an information hub. We have guidance and summaries. We have links to other resources which have also proved useful. That's the thing, I think, this pandemic has meant that we can showcase things we already have, guidance on supply chains, guidance on medicine shortages, for example. We have an online program. So from March until June, we ran 1 to 2 digital events every week. These could be educational, these could be information sharing, these could be updates, or they could be more discursive. They could be panel events whereby we were bringing together colleagues from a particular area of practice and getting them to share views and opinions and thoughts. The other thing was that we then we also linked here all of the other events that were happening at the same time so that everybody could see how it all fitted together. The fact that we would update this weekly, daily, bi-weekly, dependent on how we would be asked by our members and by the profession at large, meant that this was a very responsive hub. And I might say that whilst we have, and we represent more than 4 million pharmacists and pharmaceutical scientists and educators globally, we have probably about 5,000 members. However, all of this was freely available to the whole profession and to patients as well. So that's why we developed some guidance sheets, because patients and the public could access it as well. We developed this under the banner, the digital events were responding to the pandemic together. This provided our professionals with a bit of a feeling that they were being looked after. There was a network that was supporting them. We used Facebook to create an online platform for pharmacists to discuss and exchange queries, experiences, worries, general initiatives. And whilst we saw that some practices were changing in some countries, where they weren't changing in other countries, this change of information, this exchange was super helpful for pharmacists in different countries to see how others were doing it. It wasn't just about FIP responding either. We have more than 150 member organisations, and we decided that it would be really useful to showcase and share their resources with others as well. So the organisations and some of our corporate partners and our allied partners who had very, very good levels of information and data, we put this into a repository of related resources. We also issued different statements, technical, scientific, professional, whether it was a statement of position or a holding statement that could possibly be updated at any point in time on various issues. So what else have we done? Well, at the very start, we advocated to governments and international organisations, including WHO, so that the role, the safety, appropriate recognition of the profession, pharmacists, pharmaceutical scientists, and pharmaceutical educators, was a priority. You would all hear very often health workers being highly lauded, and every single health worker has really stepped above their pay grade this whole pandemic time. But very often it would be doctors and nurses that were being focused on, and pharmacists wouldn't be mentioned necessarily. Yet in every single community, pharmacies were opened and accessible to patients. And it was really important then that governments saw this, recognised this, and then sought to support this. Many of these pharmacists and pharmacies are, they work alongside the health systems and provide services to the health systems. And they made personal investments in making sure that their patients and their staff were safe. And this was a really important thing to get across to governments. In fact, I must say, the governments that have seen the work of pharmacy, they have been very, very grateful and have applauded it and have sought to continue to recognise that. We then issued a call to action to support the profession on the front line. And the call to action included 23 urgent measures that governments and other stakeholders must put in place so that there's a continuity of care to people around the world, and so that pharmacists can play an even greater part in the fight. And I think as we watch the Southern Hemisphere struggle and come out of the flu part of the season, and as those of us in the Northern Hemisphere enter the start of a more autumnal feel, the idea that this pandemic is over is a false one, and we need to come to grips with that. So some of the measures that we have called for is that pharmacy staff are recognised as key health workers. Pharmacy staff have access to the appropriate protective equipment, that we are included in the groups of healthcare and essential workers to be tested for COVID-19, that medicines at risk of shortages are identified and mitigations plans put in place. Let me really remind everybody that shortages were a big issue for FIP and for all of our regions last year. The supply chain, the fact that we see manufacturing of medicines in particular countries, and that puts us at a great vulnerability if something goes wrong, was a problem for us at the beginning of this year and has been growing over many years. And COVID has just highlighted that and exacerbated it, as it has done many of our other priorities. That we also sought funding for continuing education in infectious diseases and emergency response. That really, to acknowledge that some of this needs resource is really important. And I think whilst many professionals have given above and beyond, we do need to ensure a sustainability of health service over the next 6, 12, 18 months and longer. We issued a statement of principle on the impact of COVID-19 on health equity, on vulnerable patients and their populations. Now, just wanted to give you a little bit of background across community, hospital, and our educators. I know the educators don't necessarily face frontline care, but it's interesting to see how they have responded as well. So many of you will know community pharmacies represent the first point of contact within the health system for many communities, and that pharmacists not only enable the supply of safe and effective medicines, they play an important educational role. In several countries, pharmacists partnered with the government to ensure there were good supplies of face masks and PPE. The governments also supported them to encourage symptom detection and referral pathways. For example, in several African countries, there are papers that describe roles played by community pharmacists, whereby they educated the entire community population on safety and infection prevention recommendations. And this actually is a model for many of our other countries, which we have found very gratifying. Then, in the face of shortages, we have seen our profession called upon to participate in different priorities to ensure adequate supplies of health products and medicines. In addition, this also includes medical devices and supplies of dressings, etc. And we saw some studies, questionnaires and interviews amongst Egyptian community pharmacists, whereby the respondents reported high rates of PPE, medicines provision and mass distribution. And again, much like the example I gave previously, to see such examples of innovation in our colleagues from Eastern Mediterranean region and the African region have been really gratifying. We've also seen examples whereby administration of COVID-19 vaccines by pharmacists across the American region, USA, Brazil as examples, has been second to none. This is built on some enabling legislation that was in place to allow pharmacists to vaccinate anyway. And then this has been broadened to ensure that pharmacists and their teams are appropriately supported to administer COVID-19 vaccine as and when we get it. We saw frameworks emerging in the UK and in Canada in which pharmacists ensured a continuity of health services through new professional activities and expanded scope of practice. Now, how would that work? Well, when routine or elective checkups with doctors are either reduced or just not available to anybody, then formulary or drug scheduling modules may be adapted to help community pharmacists assess and manage patients with what might be termed as minor conditions. Maybe they don't warrant a referral into hospital, but actually they're causing discomfort and they're causing concern and worry. And we've seen that continue way beyond any lockdown was loosened, and pharmacists have been continuing these roles. It's a role that pharmacists should be playing and that we've been lobbying for a long time. So we are delighted to see this being taken up. Now, expanding prescribing roles for pharmacists will be important. In many countries, we have the legislation and the regulations in place to enable pharmacists to prescribe directly. And if you're thinking about how patients might access safe medicines, actually having more safe professionals enabled to prescribe is a really good way to do this. Hospital pharmacists played a crucial role during the pandemic as well. And this was quite mirrored if you look at the ways in which the profession has stepped up. So storage and supply of appropriate stocks was also an issue in hospital. And pharmacists were key in this to identify and find the supplies of medicines, medical products and devices, masks, thermometers, goggles, other necessary equipment that the hospital may need. And that was really important because the hospitals were on high energy alert levels. And of course, there's so much isolation in parts of the hospitals themselves that those pharmacists needed to ensure that the distribution units in the hospitals were adequately supplied. There was a big step up. The camaraderie between healthcare professionals and health workers has been huge throughout this whole pandemic so far. And that collaboration has really, really led to better patient care. In addition, promoting hospital prevention and infection control, making sure that antimicrobial resistance and stewardship agendas are still being met, maintaining information and counselling, not just for patients, but also how to manage information flow with staff, especially remember the mythbusters I was mentioning. Literally within days, you could see news of one medicine coming out and then being withdrawn by the end of the week. We saw that with hydroxychloroquine. We also saw the emerging use of dexamethasone, which is a very old drug, old and safe and very cheap, but only really to be used in high-risk patients, which is really important because then our hospital pharmacists could provide evidence of the impact. And the pharmacovigilance word is one that we take very seriously in our profession. Monitoring treatment outcomes is a really important factor for us in pharmacy. Lots of papers that have been published. And that's one thing I would say, the publishers globally have really enabled good practice to be published. There have been risks associated with this. We've even seen, laudable journals like The Lancet have to withdraw papers within a day or two of publishing. But really pushing these papers out without the long delay between submission and review and publication has meant that people have been able to be on their tiptoes in terms of responsiveness. We also saw a lot of work being shared through our Chinese organisations and members. At the forefront of the outbreak, China formulated and launched a series of emergency plans. And I think that level of cooperation has been really important for our profession. They were fundamental for FIP to develop our guidance in early February. If we hadn't had them, it would have taken us much longer to be so responsive. Those colleagues also developed a pharmaceutical care framework for COVID-19 hospitalised patients. I'll describe that in a second. But the services are aimed to improve hospital outcomes and reduce overall mortality. And the fact that we have a framework that many are using means we can compare the data. And you'll see that here. Very easy to observe. The various stages of the work is really around decision-making, monitoring, both the safety and the efficacy of the medicine, and managing the interactions the medicine may cause, especially if a patient's on other medicines, for example. And that's where we have seen a high level of risk with patients who suffer concomitant comorbidities and have to take lots of different medicines for non-communicable diseases. They seem to have fared worse in the COVID-19 pandemic. There's also in the framework special provision for special populations. Now, of course, every patient is special, but there are particular populations that are more at risk and particular populations who are more frail, less accessible, perhaps more vulnerable. As I mentioned to you just a second ago, there has to be some consideration of patients who have several combined underlying diseases and how we manage them. And the monitoring and management of convalescent plasma therapy has been a huge, important involvement of hospital pharmacists. This hasn't come without its emotional scarring and its emotional impact, and the idea that pharmacists can be involved in either providing counselling or just admitting that they might need some has been really important. And then, of course, keeping up to speed with the scientific information about vaccines development. We also saw another study that came out of China, again, sharing straight away about the supply and management practices at different hospitals during the COVID-19 pandemic. And this described the 4 axes of hospital management as personnel, drug supply, medicines that may not be licensed for particular indications but are described as off-label and how they have to be managed. And obviously, there's a great interest in managing medicines off-label so that we can test and see if they are having an impact in a certain way. And then the pharmaceutical care elements that were mentioned on the previous. What was really interesting of the outcomes here was there were no nosocomial infections or medication errors in the study, and patients that were admitted had no serious adverse reactions. So the framework and the axes actually supported good patient outcomes. A little bit about education. So the global COVID lockdown meant that FIP had to provide a rapid response survey to many of our pharmacy educators. And we have a very big cohort of pharmacy students, or those that may be graduating very soon who would be in practice. And we know that this has also caused a huge impact on all our health professions. So we published a set of case studies from the survey that were published actually today. And there's the publication there. The survey had 225 out of 371 responses from 63 countries across all of the regions, and you can see the breakdown there. But whilst the paper itself is quite detailed, what we really saw across all our regions was this great outreach, a great transfer to digital economies, but the success of this is very dependent on income levels. So FIP is seeking to understand this better and seeking to identify what support our students and our young people and our educators need in low to middle income countries. It's really interesting, isn't it, that many of the things that we have done have been a result of such a terrible crisis, but have really sped up some innovations, both across community, hospital, and academia in our profession. Much more focus on outcomes and much more focus on experiential learning, even though those colleagues haven't been able to perhaps access so much patient experience. So to round up, colleagues, I just wanted to leave you with some concluding remarks. This pandemic highlighted the importance of community, hospital, clinical biology pharmacists to ensure the continuity of the supply of medicines, supply of medical devices, and actually more than that, to ensure optimal use, as well as in health education and infection prevention and control measures. Really important that whilst the supply was maintained, the use and the impact was also fully explained. We can't think about what the world will look like after the pandemic is completely over, but we can think about this in a staged approach. While we move one stage of the disease, and we move into another. And after the pandemic is over, it's paramount that the service we delivered, the value they contributed to the overall health and the efforts of the health system and healthcare teams are maintained. That would be, for me and for my profession and for patients and the public that we've served, the biggest shame if that were to all go back to what happened before the COVID pandemic with no account of some of the innovations that we have undertaken. And the same really is to be said for my colleagues in academia. In similar ways, there have been great innovations, and this is really important, not just for the students that are being educated, but for patients down the line, because these students are going to come out so resilient and such great professionals. Important links I wanted to share with you very quickly are our information hub, which I mentioned at the beginning, and our Facebook page. And there's a bibliography, which I think would be really useful if people wanted to follow up. Thank you so much. There's the website again. And as I say, it's open to anybody. And because this is all about medicines and medicines use, we think that would be very useful for many people. Thank you.
Good evening. It is the 9th Global Patients Congress 2020. We are in the Community Pharmacists section, where we are to discuss on medication and overall patient safety. Herein, we are going to discuss on the role of community pharmacists played during the COVID-19 pandemic. I am Dr. Anantanaik Nagappa, representing Association of Community Pharmacists of India, and every continent had suffered a heavy morbidity and mortality. It affected all spheres of human activity, especially Europe, USA, and rest of the world become the victim of COVID-19. The COVID-19 is highly infectious and it spreads through by droplet in the air coughed by the COVID-19 patients. It deranged the economy, social behavior, health activity, and also led to the ban of travel within the country and across the country. So there are no medicines. Even today, after 6 months, no vaccines. The treatments are either symptomatic and empirical. Preventive precautions to check infections include social distancing, home quarantine, hospital quarantine, wearing masks to cover the nose and mouth of individuals, and avoiding the crowded places, and washing the hands with soap and the alcohol-based disinfectants. Normally, the community pharmacists in the society are in direct contact with the patient and help consumers for providing their services. Due to COVID-19 pandemic, community pharmacists are forced to practice their profession in isolation or remoteness. Community pharmacists are to care for themselves and the patients from COVID-19 infections. The window shopping with glass coverage shall be the new order of pharmacy practice in community pharmacy. New technology has been developed and utilized to avoid the pandemic spread in the community. The dispensing shall be without direct interactions. Robots and automatic dispensing machines are put into practice. Patient counseling and education via video chat and interactions. E-pharmacy and e-prescriptions have got more scope, and home delivery of medicines, home medication reviews are the new practices or opportunities due to COVID-19. Virtual video conferencing, telehealth services are put to use for the pharmacy practice and pharmaceutical care. The community pharmacists should be and always be the champion and leader in patient education. They should update and be able to provide unbiased, correct information to all the needy patients and health consumers. Health consumers and patients are under tremendous stress and fear due to negative news and media exposure. Community pharmacists should be able to bust the false negative information. Community pharmacists should always remain updated with knowledge about COVID-19 and appear confident in front of the public and the health consumers. Mild, the COVID-19 disease can be classified for the purpose of treatment to mild, moderate, and severe. The mild patients are those having fever without shortness of breath and have upper respiratory symptoms. They can be kept in home isolation to recover from the disease and also to help them in preventing spread of infection in the public. The moderate, whose respiration rates are less than 24 or more than 24 per minute, and oxygen saturation is less than 94, they need to be admitted into the wards. The patients with severe conditions, whose respiration rate is more than 30 per minute, with less oxygen, 90%, need to be admitted in the ICU immediately. The high-risk patients are patients with age more than 60 years, patients with cardiovascular disorders, including hypertension and coronary artery disease, diabetes mellitus, and immunocompromised patients, patients with chronic lung, kidney, liver diseases, cerebrovascular diseases, and obesity. The medication error is another challenge faced by the community pharmacists while treating the COVID-19 patients and health consumers. The utmost importance and focus should be given to the medication errors on priority for COVID-19 patients as they are already immunologically down. Checking the drug-drug interactions, doses, and ADR in COVID-19 patients is a priority, and they should prevent the untoward effects and provide the safety from the drugs. So, as it was mentioned in the earlier, there are no medicines, vaccines, and therapeutics therapeutics, and still it is the only symptomatic treatment. Available drugs are empirical without evidence. They are hydroxychloroquine, antivirus drugs, dexamethasone, immunotherapy-based therapy, H2 blockers, COVID-19, plasma therapy, symptomatic antibiotics, and anti-cough remedies. Community pharmacists are very much called into action as the patients and public are ignorant and tend to behave irresponsibly towards the established guidelines for prevention. Community pharma should always alert the patients and health consumers constantly to adhere to the guidelines given by the local authorities, and if any deviation in the behavior should be corrected immediately by pursuance and other things. And also, community pharmacy should also indulge in the preliminary screening of COVID-19 among the visitors to his pharmacy. And in case anybody showing signs and symptoms of COVID-19 should alert healthcare system and counsel the patients and health consumers for a quarantine, depending on the symptoms as described before. So in India, the early measures had helped to slow down the spread of COVID-19. It included closing of schools, campuses, and government offices. Public and social gatherings like marriages are banned for a while. Public transport, international and national restrictions were enforced.